This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield. And 3D printing is affecting healthcare. How so, Doctor?
Well, we're all familiar with normal 2D printers. Of course, they use ink to print on a page. 3D printers are different in that they use not ink but different materials, which could be metal, plastic, even human tissue, and they are able to print objects.
Oh, that's cool. So how do 3D printers, how can they be used in healthcare then?
Well, these printers, Brian, can generate models of complex individual anatomy. And you can see the value of that because it can help, for example, surgeons as they plan their operations.
So a surgeon would, what would a surgeon do then with a 3D printer?
Well, the surgeon, he or she could visualize better someone's complex anatomy and plan the course of his or her entry into the body.
That is really cool.
And know exactly precisely what needs to be extracted and what needs to be left behind.
You could even possibly work on it in advance and try to figure it out, how to access a tumor or whatever it happens to be.
Because you think about it, in many things, practice makes perfect. So if you can practice before that surgery, you can perhaps perfect your technique.
Wow.
Okay, I want to talk about women's hormones, and I don't want to give too much information, but a recent study was conducted about women's hormones going through, a stage of life that I am currently about whether or not you should take hormone supplements. Speak to me about this, Doctor.
Yeah, a lot of women have been reluctant because they've heard these concerns about an elevated risk from undergoing hormone replacement therapy, or HRT.
Okay.
And those concerns revolve around an increased risk for such things as breast cancer, heart disease, stroke. Well, fortunately, this long-term study, which was recently published, just found that actually HRT is no more dangerous than anything else, that it's indeed safe and efficacious.
So safe, I'm going to put up my air quotes and say safe. What do you mean exactly by that?
Well, the many women in this study who were assigned randomly to take replacement therapy were no more at risk than women who did not of any elevated chance of death.
Can we ask you quickly about this? I had never heard of this. So there's this character in the TV show American Horror Story, which some of you may be familiar with, who is generating awareness of this phobia called Trypophobia. Is that it? What in the heck is this?
Trypophobia.
Trypophobia.
It's a proposed phobia, which is, of course, an intense, irrational fear of irregular patterns or clusters like you would find in small holes or bumps. So think of a honeycomb or a strawberry or a piece of coral. Some people are actually disgusted, and some even have an intense reaction to these images.
That is so bizarre. Why do you think this fear even exists?
Well, it could be based, Brian, on some unconscious reflex reaction where our brain may think that this image is associated with something dangerous. So think of holes made by insects or holes in wounds.
Okay.
And diseased tissue.
Sure.
Or it could be that some people fear these holes because they think that something may be lurking within.
Oh my gosh, that's so interesting.
Man,
it's always good to see you. Thank you. So this portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.